Awesome. I think a couple of people said that they're going to join in a little bit late. So I'm gonna maybe just start us off. Since we're a small group, maybe we could just do a quick round of introductions and make it like a little bit more conversational. We've started the recording, so whenever people are able to come in, they can join us from there. Otherwise, they have access to our recording. But yeah, maybe we can just do a quick round of introductions. Hi, Eves, do you want to go first?
Yeah, thank you very much, Priyanka. This is Eve. I'm now in DRC, precisely in a region called Uvira. It is in the eastern part of Congo. I work for an organization called UGFI, which is a partner of GSF. We are running a secondary pilot school in a remote area. Actually, our region of interventions are mainly remote and rural contexts where we have much difficulties of having access to education. That's what we are doing. My organization is also working in South Sudan. I think this is enough. If you have another question, maybe I'll answer. Thank you, Priyanka. Thank you, everyone.
Thanks. Thank you, Eves. I don't know, Kanupriya, do you want to go next and then tag someone?
Sure. Hi, I'm Kanupriya. I work with Children in Crossfire. As we were just saying, we are based in Northern Ireland, and we work on early childhood education in Ethiopia and in Tanzania. So early years, both with the government system, but also with private providers, increasingly in the urban space. So I'll pass it on to Matt, who's also my colleague at Children Crossfire, so he won't have to repeat some of the information.
Yes, thanks, Kanupriya. Yes, we are two sides of the same coin. If Kanupriya is Mel and impact and measurement, I'm around. I mean, I'm the head of programs, so just I guess looking at how we deliver our programs, partnerships, and general strategic direction, I guess. So we work very, very much together as we're two halves of the same person in a way. So yes, good to be here. I'll pass to Alia.
Thank you. Really lovely to meet you all. I am Alia Mohammed. I work for Innovations for Poverty Action in Uganda. I work with Obed, who's presenting today on the Dual Generation Initiative. Lovely to meet you all.
Alia, do you want to tag someone?
Sure, Oscar.
Hi everyone, I'm Oscar Pineda. I work in IPA as well. I work in Colombia as a policy manager. I am currently leading the ECD portfolio as well as an innovation lab we have in which we actually incubate ECD programs based on evidence. So nice to meet you all. Robert, wanna go next?
Thank you, Oscar. Sorry. Yeah. And we, together with Oscar and Alia, I also work for IPA, but Oscar is in Colombia. I'm based in Uganda. I'm also a policy manager like Oscar, working with our Uganda country program. And I will pass over to Natalia.
Hi, I'm Natalia. I am also from IPA and I work in Colombia. I am policy manager and I am leading the migration portfolio. And I will pass to, I don't know who else, maybe Ana?
Yes, hi everyone, I'm Ana Serrano and I'm the Associate Director for Innovations for Poverty Action in Colombia. I'll pass it on to Godfrey.
Godfrey, are you there? I don't think he can hear us. Maybe we can go to Edmund and then Kilwell and then proceed to this session. And
I'm there.
oh
I'm
yeah,
there. I can hear you. I'm Godfrey from Labe. It was adapted basic education you got.
Hello, everyone. My name is Kulwel Agok. I'm the program coordinator for the Refugee-led Organization Network based in Uganda. So we do advocacy around ECD and childcare. And we also do capacity building to the refugee-led organizations across the country. Thank you.
I think Edmund, you're the last one.
My name is Edmund. I'm here from Labe, Uganda. Nice to meet you.
Amazing. So thank you everyone for making the time to join us for the session today. It's a fairly small group. I think a couple of people are going to join at 30 minutes after the meeting has started. But I think we can basically get started, and we'll keep it a little bit more open and conversational since it's a small group. But I really just wanted to start off by setting off the context, which I'll just take a couple of minutes for at the beginning of the session. So this is sort of the session where we're going to talk about what will it take to create an enabling environment for scaling dual gen programming in humanitarian contexts. This is, like you can see, it's the 6th session and also the last session as part of the COP series. We've been engaging with many of you over the last 3 months on sort of different facets of sort of the dual generation program. We really started by talking about the underlying theory of the 2Gen approach, and then focused more on specific innovations happening in child-facing programming and then caregiver-facing programming. In the last session, we really talked about measurement approaches for measuring play and measuring sort of self-reliance in refugee households. And today we're really going to just step back and look at systemic factors that can really advance the programming and implementation of dual gen programming specifically in humanitarian context. But before I proceed, since it's also the last sort of session, I just wanted to take a minute to just thank all of you for all the time that you have given to us over the last 3 months, just sort of engaging with us, showing up for these COP sessions, engaging with each other, and really to some of you for volunteering the time to present more about your program and really use that as strong sort of anchors for facilitating the rest of the session and sort of getting more specifics specifically into some of these thematic areas. We've really covered a lot of ground in the last few months. I just really wanted to give you a sense of the kind of reflections that we've been able to generate over the last few months together. This is just a very, very, very small sort of like snapshot of what we have done. What we're working on is also an extensive sort of guidebook, which is really codifying some of these learnings and programmatic innovations that we've shared as part of this group together. I'll come a little towards the end of the session to really talk more about the guidebook and ways that we can engage further on developing that toolkit. But also just wanted to take a minute to just bring your attention to some of the points that are on the right sort of side of the screen, which are essentially things that have come up in some of our past conversations where we've really talked about, despite really not having a session specifically dedicated to systemic barriers. I think they also came up in quite a few of our previous conversations, specifically around just the challenge when it comes to coordinating sort of dual gen programming across multiple sectors and ministries. We talked a lot about lack of flexible funding, where it's really hard for programmatic organizations to focus on programming for both children and caregiver at the same time, if like the funding protocols don't allow for it. We also talked about sort of just lack of gender parity when it comes to dual gen programming, and predominantly a lot of the household sort of responsibilities falling on women. And lastly, also had like extensive discussions and debates about just absence of measurement frameworks that really allow us to capture outcomes for both children and families at the same time, given that the group sort of was also leaning a little bit more towards sort of integrated dual gen programming that really focuses on providing a coherent support for both children and caregivers from the same families at the same time. So these were some sort of systemic barriers that have come up in the past. I just kind of wanted to revisit those very quickly with you before we head on to the session today, which essentially is a little bit around learning a little bit about how systemic actors really view dual gen programming for humanitarian context. What interests them? What do they find concerning? How are systemic actors responding to some of these challenges? What is working? What's really not working? And also to just have a little bit of a discussion and debate on the kind of research and evidence generation that we as practitioners can work towards that would eventually help systemic actors to really advance the agenda of dual gen programming in context of specifically humanitarian settings. So that's essentially the larger sort of agenda that we have for the session today. I'm going to hand it over now to the IPA team from Uganda and Colombia. We've already done the introduction. So we're going to first start with Obed, who is the policy manager at IPA Uganda. They've recently conducted a needs assessment on policy and practice in the region. So they're going to give a quick sort of snapshot of some of the learnings from there. And then we're going to hand it over to Anna, who's the associate director with the policy and development team at IPA Uganda at Colombia. So yeah, I think on that note, I'm just going to pass it to you, Obed. I'll continue to share my screen. Let me know when you want me to move on to the next slide.
Thank you so much, Priyanka. I'm very grateful for the opportunity. We are going to be speaking about our engagements with policymakers in Uganda, in line with the theme for today. So I will go straight to the next slide, Priyanka. My name is Obed Kambasu. I am a policy manager at IPA Uganda. With the two-generational or dual-generational initiatives, we are implementing together with Alia Abdallah Mohammed, who is also on the call, who is a senior policy associate with IPA in Uganda. Alia leads most of our work in terms of implementing and also coordinating and working closely with the policymakers and also the researchers and implementers. So in case of questions, obviously myself and Alia will be on hand to be able to explain from the Uganda side of things. The next slide. So just briefly, I want to speak a little bit about IPA, Innovations for Poverty Action. I could go deep and explain this in so many minutes, but I just want to explain what we do. So IPA is a policy and research organization, and our approach really to evidence co-creation is about working with actors, different actors. So we work with implementers. That could be NGOs, that could be networks, but we also work with policy makers. And together, we want to identify issues and co-create solutions. And there is something that we call evaluating solutions. When we talk about evaluating solutions, this has different phases. But one of the things that IPA has been known for a long time is conducting randomized controlled trials, RCTs. So we have been known for that, which is having some sort of control group and a treatment group and looking at if the intervention would have different outcomes or if the treatment group definitely improves or changes as compared to the control group. And so IPA has been doing these rigorous evaluations for the past 20 years. We have done more than 900 rigorous evaluations, RCTs. But now one of the realizations that IPA has come to is that it's not enough to have RCTs and just publish papers and do that. Now we also have to try to bring our evidence to the policy space, to implementers. So one of the other things that we do then is we try to incorporate this evidence into programs and into policies. Throughout this process, we are working with partners to make sure that they are utilizing this evidence. So it means that if we are evaluating programs, we want that this information, this data does not lie on the shelf. It is informing programming, it is informing policies. So even when I will be speaking a little bit about our needs assessment, the whole idea is not just to assess needs. It is to equip implementers like yourselves, it will equip policy actors with the skills, with the information they need to implement more evidence-based interventions. So I'll go to the next slide, Priyanka. Now, from the Uganda perspective, or even from the IPA perspective, we have been implementing research, programming, and policy work from the two-generation or dual-generation perspective, which is our work of the dual-generation initiative is funded by the Hilton Foundation. And in this initial phase, which we started with, we are focusing on forced displacement in two national contexts in Uganda and in Colombia. Because our Colombia colleagues are on the call and they'll be making a presentation, I will not speak on the Colombia side of things. So I'm just focusing on the Uganda side. And then my colleague Anna will be speaking more about the Colombia side. So in Uganda, we have conducted a policy and practice needs assessment. Priyanka refers to that. And from that needs assessment, we have been able to draft an initial policy and research agenda. What this means is that we have mapped out policies that we think are relevant or would benefit from dual generation programming. And we have also mapped out research, interesting research topics that the implementers, that policymakers think we need more information on this. We need more information on this. But we have also mapped out what is existing as dual generation programs. And we also have conducted and are conducting initial research activities. In Uganda, for example, we are studying time use, looking at how parents utilize their time when they are involved in dual generation programs. So if you involve parents in a livelihoods intervention, how does that affect the time then they have for child care? Or if parents are expected to have more interaction with the children, how does that then affect the time they might reserve for personal development or family development? So we are doing that. We're also studying family composition and the political economy of ECD, and that is a very key thing for us. We are also a learning partner for BRAC. BRAC, who is a member of the GSF community, they are implementing, combining humanitarian play labs and ultra power graduation in refugee settings, and IPA is a learning partner. What this means really is that we have set up an RCT on BRAC's work, and that we are working with BRAC along the way to learn, to pick out what are we learning from this work. But the other thing that we do is we try to synthesize and disseminate evidence. For example, we have an evidence review on child care. So we try to make sure that we get evidence from different contexts and we can share it with the practitioners like yourselves and also with policy actors. So I'll go to the next slide. Now, in terms of what our policy and research agenda has looked like, from the needs assessment, we have mapped so many policies. By the way, we have about 43 policies that we mapped, but we think that 20 of them could be priorities for future collaboration. And this is because they have upcoming decisions to influence. For example, there may be an upcoming policy review or an upcoming development or even something. So we think that people who work, and not just IPA, but organizations which work in this space have the opportunity to contribute to the development or review of these policies. So we think these are, because what is important also with working with policymakers is to understand their priorities, because it's really difficult to determine what government is going to do. But when you fit yourself within what government considers to be priorities, you have better chances of influencing. And most of us on this call obviously know this. So we have mapped out what are these policy or upcoming decisions that we think would benefit from the 2-gen or dual-gen programming. But we have also listed what are the priority topics that people believe? And when I'm talking about the people, we consulted people who implement programs, especially that target adults and children. And we also talked to policy actors, especially those who work on programs or in departments that are refugee facing. For example, in Uganda, also the Prime Minister, for example, the Ministry of Gender, the Ministry of Education, the Ministry of Health, where they have different programs that are targeting both adults and children in the refugee setting. So we have asked them, what do you think are the priority policies to look at? We have also asked them what could be these questions that maybe need to be investigated further. So that is something that we are highlighting. The next slide, Priyanka. So in terms of, I like this graphic, and maybe I can give justice to explaining what we are looking at. But in terms of how we are looking at this whole thing, we are looking, first of all, I want to emphasize collaboration. I want to emphasize that coordination is something that comes up from the notes that Priyanka was saying, and is one of the key things that came out also from a needs assessment. And one thing that we see is that actors and even policy actors, for example, tell us that, but you NGOs, you are not that coordinated. Who should we listen to? We don't know what you are talking about. You come, you tell us this. Then the next day you come and tell us this. So the issue of coordination, but even within government, there are a lot of things happening in this department that this department is not aware about. So this coordination is a big issue. But in terms of how we want to look at policy influence from a 2Gen perspective, from the aspects or from the side of IPA Uganda, we have identified key areas, and I have just mentioned that. There we have identified policies, we have identified the research priorities, we have identified existing programs, but we have also identified what actors think are the key issues that affect children and their parents. And so we want them to move these to the policy space in terms of what are the policy opportunities. I think for us, it is more important not to look at what are the policies we want to influence, but what are the policy opportunities. IPA likes to call them high impact policy opportunities. We even have a first word for it, HIPO or HIPO, H-I-P-O. We are looking at the opportunities. We are not looking at, because it's easy to think about what would we want to change, but we want to say, what is government working on? How can we partner with the government? How can we fit within the government policy priorities? How can we prioritize what they are prioritizing? Because putting things on the government agenda is one thing, but also supporting the government agenda. And when I say supporting, I don't necessarily mean that you should do what they are saying they want to do, but to try to make sure that you are facilitating them to do their job, that you are being a partner is one key thing for us. So we have tried to map out policy opportunities, but obviously we have also seen that how can we prioritize which ones to engage in? And that means also we are looking at where do we have evidence? Because it's also easy to see that they have this, but do we have the evidence that will feed into that policy process? So that is very important for us. It's also about the resources. It's also about which other partners are involved. And the other thing that we go to, which is the third bit, is even when we have evidence, even when there is an opportunity, we want to use that data. We want to use that evidence. We want to speak to best practice to inform the priority policies. So the most important thing is not to have the evidence, but it's also to support the policy actors to utilize this evidence by way of what they are doing. I can give an example. So, for example, in Uganda here, the Ministry of Gender is reviewing the national GBV policy. But IPA has seen this as an opportunity and is collaborating with the ministry as an evidence partner. What that means is that it is supporting, it's mapping existing evidence that the ministry could use, but also supporting to facilitate the ministry's coming to the end. Please.
Sorry, just confirming, am I frozen or is Obed frozen?
Next slide. I can hear you.
Okay.
Yeah. Okay. So this is this is more to go through all these. I'm just mentioning that these are examples of the policies that we have, for example, MAP. But this is an ongoing process. There are others that have been coming up even after doing this mapping.
Obed, I think we've lost you. Are you around?
I'm sure he'll be back in a few minutes, probably just some network issues.
No worries. Oh, he's back. Hi, Obed. Can you hear us?
I think he's actually gone completely.
Oh,
think
I
he-
see him on the
Oh, there
left.
he is. Yes, yes.
Sorry, I'm really sorry about this. It does happen when you least expect it. But I need only 2 minutes, Priyanka. I'm sorry about that.
No worries. Go
Okay.
for it.
Yeah, okay. So I'm sorry about that. But I was saying this is an example of the policies that we have mapped. But this is something that is evolving over time as we, even after mapping these, new things are coming up. For example, we are speaking recently to the Kampala Capital City Authority, and they were telling us they want to develop a Kampala urban refugee strategic plan. So that again would be another priority, for example, for that. So we also speaking to the Ministry of Gender, and they are talking about national parenting manuals being rolled out. So that becomes another priority. So these priorities are not cast in stone. They keep changing and they keep moving. But this is just an example of some of the policies that we have mapped that we think would benefit from dual generation programming. So I will go to the last slide. Yes. So as I mentioned that we have mapped out policy priorities, we have also mapped out research priorities. And these have been identified by partners that we have consulted. I know that we have only 15 minutes to speak about this, but I have a long list of example questions, which I will not be sharing here, just in case some people would be looking at what actually are the actual questions that you would really ask. We would be happy to share that as well. But one of the things that have been coming up is people are looking at the impact and cost effectiveness of traditional ECD interventions compared to 2-gen approaches. Because as we all know, 2-generation or dual generation is more like ECD plus. So you have early child development interventions, but you are also adding adult outcomes. So many people are asking, what is the cost effectiveness of that? Wouldn't it be easier to have programs that are, for example, independent and not necessarily combine programs for adults with the children? Does it make a difference? So things like that. But one thing that also people are telling us, or stakeholders are telling us, is the absence of in-depth analysis. For example, we are looking at refugees. I was saying, but refugees are not a homogeneous group. We should be talking about different sorts of refugees. For example, urban refugees versus refugees in settlements, new arrivals versus refugees who have been here for a long time, refugee children who have parents versus refugee children who might be unaccompanied, refugee parents and children with disabilities or other needs, refugee children and parents with many. So people are looking at, can we have more in-depth analysis of what we are talking about? So that's the key thing. And there's a lot of need for RCTs, more rigorous evaluations. And this comes mainly from the donor perspectives and other people who want to see, does this actually work? So these are also things that, and policy actors are telling us this. How do we know that it is working? How do we know that this? So this is very important. And also, obviously, around the needs and involvement of refugees. Policymakers that we have consulted have told us it is important to consult the refugees themselves and bring out the refugee voices, and not necessarily be saying refugees need this, refugees need that, when refugees could speak for themselves. So that has been key for us. Thank you so much. I will stop there for now. Thanks a lot.
Thank you, Obed, for that fabulous presentation. And I think just the mapping looks very, very, I'm sure it must have taken you a lot of time to just get through that mapping. Just any immediate questions by everyone who was listening in, any immediate thoughts, questions, reflections that you want to share? Otherwise, we can move on to Anna and then come back and do Q&A as well. But just wanted to see if there's any immediate reflections.
I've got one, just good question, Obed. It's just how is, I mean, how do the government respond to this kind of interaction that you're offering, and to what extent do you invest in these relationships with the government and the ministries outside of advocacy, and is that important?
I may just go quickly. Thank you, Matthew. These are very important questions, really. So how does the government respond? I think the government response has been that, how do we know it works? That's, I mean, there is a lot I could say, but one of the quick things has been, how do we know that it even works? This has been, so that could speak to a need for more evidence, but also speaks to a need for more involvement. So they keep saying, we don't know, you tell us this, but we haven't spoken to the refugees. Is it possible that implementers like BRAC, like Children Crossfire, like others, would give us the opportunity to interact with the actual people they serve, so that we know it from them, we hear what refugees really are saying, and not you coming to report to us what refugees want and what refugees are doing. So that is one part of, can we facilitate government officials to interact with the people we serve? So this is one part of it. The other part of it is, do we have enough evidence to tell government that this is worth the investment? Do we know that? And I think from a dual generation perspective, there is a lot of poor definition or lack of proper clarity of what it is and what it is not. So sometimes when you speak to government officials, they say, but we have been doing this forever. We always serve children and parents. We always serve adults and children. So all our programs are dual gen in that sense. And so there is a lot of, how do you tell them what is dual generation and what is not dual generation initiatives? So I think that has been one of the biggest struggles: definitions, interactions, and evidence. And then the other question was around our involvement with government. I think one key part, and it's even a shame that I didn't mention that, is to create relationships with the government actors. I think there is not much you will do from our perspective unless you are having clear relationships with people. So for example, in most of our things, we are talking about a policy and research agenda. When we first marketed, people were asking us, whose agenda is it? So when we are speaking to government people, like, you are telling us policy agenda, but whose agenda is it? Is it IPA's agenda? Is it Hilton's agenda? Is it our government agenda? And so we had to reframe it and say, no, we want to create some sort of agenda that is for you, not for us. And that meant that if we are maybe conducting an event, we want to involve them in terms of which day would be good for you. Can you give opening remarks? Can you be the one to launch, so that it is your event as Office of the Prime Minister and not our event as IPA. So in the end, it's you who is convening. We are only facilitating you to convene. For example, refugee-led organizations, we want to call them and you speak to them, but we are giving the platform for that. So building those relationships has been and is one of the biggest challenges that we have to keep building on and trying to improve. And it is a process, obviously, because you can't crack it in one day, but it is important and critical and something that you did well to emphasize, Matthew. Thank you so much.
Thank you. Yeah, thanks.
Awesome. I think we can move to Anna's presentation and then come back and have more open time for Q&A. Anna, over to you.
Thank you, Priyanka. And thank you everyone for the opportunity to present. So we're moving to a whole different side of the world in Colombia. And where I'm going to be presenting a similar exercise we conducted as the Uganda team, but in the context of Colombia. So it's our policy needs assessment on the dual generations approach. So you can go to the next slide. Just to get us started, I wanted to give you a bit more of context in terms of the situation that we're looking at in Colombia. And it's basically Venezuelan migration in Colombia that has been going over for about 4 years. And then here I'm showing you just general numbers. These are like official numbers from the national government of Colombia, which is an estimated number of 2.8 million Venezuelans in Colombia that have been registered and have been given a permit to stay in the country. In terms of like the age distribution of that group of people, we have about 4% of the sample under 4 years old. And we have about 23% of the sample between 5 and 17 years old. And out of that big group of people, we have about 52% of that group being women. We also have another situation in Colombia that I guess it's relevant to the humanitarian context, and it's people in transit through the country. So it's not only Venezuelan migrations of Venezuelan families that want to stay and plan to stay in Colombia or settle somewhere in Colombia, but also migration going up north, right? So going through Colombia and Panama and going to Central America and the US. So we have a significant number of people and families that are going through that transit, and that kind of like, I guess, makes the situation a bit more complex on understanding what are the needs of the different populations that we're looking at. You can go to the next slide. So what did we find? So we did a similar exercise as Obed mentioned. We talked to several government organizations, national and local government organizations. We talked to academics, we talked to local NGOs, we talked to international NGOs. We did over 20 or 25 interviews with several actors working in what we can call the dual generation space, right? What did we find? And this is kind of like our general assessment. There is like a very favorable, but still developing policy scenario for dual generations in Colombia. And this is probably not a surprise for anyone. And I think drawing from what Priyanka was presenting at the beginning, and kind of like the lessons and learnings that you've had over these past 3 months, it's very similar to what you would find there. So what's the particular context in Colombia? And this is mainly coming from the ECD world. So Colombia has a very strong ECD law, right? That doesn't necessarily mean that it's like great in terms of how it's being implemented, but it's really well conceived. And partly one of the central pieces of that policy is thinking about the children and their surrounding, right? So who's around children and how are those different actors influencing their development. And one of those, of course, is the family and the caregiver. So there is a lot of conceptualization, if you will, in terms of like the role that families and even the society should play around children's development. But there's still a lot to be done, right? So policy-wise, it's very favorable when you talk to people. Everyone is like completely agrees. This is the same that the law has been saying for years. But how do we actually do it, right? That's the big question. So we have mapped different programs, both from government and local and international NGOs that are incorporating this dual gen vision. So looking at the caregivers and looking at children, we have different, we have actually seen kind of like different views of this caregiver perspective. So looking at the caregiver at home, of course, and in the family, but also looking at the caregivers within like ECD centers and ECD workers. So how are we also working and building on that capacity? So I'm listing just here a few examples that are coming from the national governments of programs that are focused on looking at the two different populations. This is still nascent and there's still to be done, especially into at two levels, which is what we have here at the bottom of the slide. There is still a lot to be understood about how we implement these programs, right? So it's conceived well, lots of challenges in terms of how it's being implemented, and definitely lots of challenges and gaps in how it's being measured. And you had this in your summary at the beginning, Priyanka, right? We do not know exactly what outcomes we should be looking at for both populations at the same time. What's the best way to measure without creating like a significant burden of measurement in programs. So this is our general assessment. It's favorable, it's still developing, everyone agrees, everyone has great ideas about how to pursue this forward, but still lots of gaps, lots of learning questions. You can go to the next slide. So what did we find? And this is just a simple graph of what you would expect in terms of the outcomes and types of interventions that we found in the ecosystem. So of course you have all of the interventions looking at caregivers and all of the interventions looking at children. There's still that missing a link in the measurement. And this is a question that has come up a lot, for example, from the livelihoods world. So like if I'm working on generating income for families in a particular context, right? In a humanitarian context, in a migration context, what should I be measuring? And what should I expect to achieve for children or like as a household, right? Am I supposed to be an expert? If I'm a livelihoods organization, am I supposed to become an expert in ECD? Or what am I supposed to be doing in terms of like making these interventions more, I guess, more intended for the needs of these families, right? So we have these two different spaces. We have also the interaction. So where do we see that parents and children actually interact? It's of course in the parenting space. So how do we provide better skills for parents to be able to respond to different scenarios, especially when we're talking about humanitarian contexts and when we're talking about migration and families that have not, do not have like a strong networks in where they're settled. So we have all of these outcomes that I don't want to get into, but this is just to give you an example of all of the policies and programs that we were able to map out, right? Again, always keep in mind this big gap in terms of how we implement and how we measure. This is kind of like something that we saw constantly on all of the engagements that we had. You can go to the next slide. So here is just a brief overview of the main areas that we were able to find significant efforts, but also significant learning needs, right? So, and by learning, I mean like in terms of implementation, but also in terms of research, like deeper research exercises. So we have mental health, which is not a surprise for everyone. There is lots of work in mental health independently, but not necessarily as a family. In Colombia, this is also a bit mixed in terms of the context that we're looking at. We have migration, but we have also a significant number of IDPs, internal displacement. So there is like a lot of, I guess, mixed programming for what are the needs of these families. And I guess where is what it's causing their, the situation in which they're living. So how do I address mental health issues for families that have been internally displaced? How do I address mental health issues for families that have migrated to Colombia and they want to stay? Or how do I address mental health issues for families that are migrating through Colombia but are planning to go somewhere else? So like plenty of different needs. We have income generation, of course. This is one of the biggest issues, and something that I will want to share about Colombia is that because we remember the 2.8 million number that I shared at the beginning. So the Colombian government has been providing permits for Venezuelan families to stay in the country. What that means is that people get access to like a national ID, and they can pretty much access anything. They can get a bank account, they can be hired for a job, for a formal job, they can go to school. In theory, they don't have any legal barriers if they have that permit. I guess the big question is, if I regularized almost 3 million people in a country, how do I make sure that we have that we're promoting social and economic integration of those families into the country, right? So as I mentioned, you could remove legal barriers, not for all of them, but for a significant number of them. But what's happening also for them in terms of accessing social services, getting a job, and it could be many different factors that are introduced there. You can have xenophobia, you can have many other problems that are like any other type of barriers that are not legal barriers, that are generating even more, I guess, making it more complex for how do I generate income for this family? Do I work on employment programs? Do I work on entrepreneurship? What are the capacities that we need to build in these families and these in this group of people to be able to let them generate their own income? We have caregiver skills, and this is something that I already touched on. So it's a lot of parenting, and how do I provide parenting skills for these families? This is, I guess, becomes even more relevant when we're talking about humanitarian contexts. I guess this is less relevant in Colombia now, but like a couple years ago, when we had significant number of families walking through the country and kind of like finding their places to settle or to move somewhere else or to different countries. We even worked on interventions that were looking at building that capacity for parents, right? So I'm not assuming that kids are going to be attending a permanent ECD center from the government or like from any organization, but rather relying on the ability and capacity of the caregivers to be able to provide some type of support to those children's development. So that's one thing. We have a cross-cutting component on gender, which is, of course, you would see greater impact in terms of like income generation, incomes in terms of social integration, mental health issues on women. So this is prevalent in pretty much all of the work that we're able to map. And then the social integration piece, which is something that I already touched on, and is what's this? I mean, how are we promoting social cohesion, right? We welcome significant amount of people into the country, and how is the country like citizens and people just being able to receive that, especially in a country in which we have so many other problems, internal problems, right? So we have over 50% on informal economy. So how do I make sure that we absorb that, and it's not like migrants coming and taking jobs, or like what's behind all of that? So how do we welcome or not welcome migrants into the country? You can go to the next slide. You can actually skip all of those, Priyanka, because I touched on, and you can share this presentation, just going into more detail, and you can go to the last slide. Thank you. So we learned a lot, right? So what do we do now? We know there are many organizations in the field working on this, trying to figure it out. We know there is research being undertaken. We know there's a lot of research questions yet to be answered. So how do we drive this forward, right? And one of the things that we're starting to do at IPA Colombia is leveraging from our already existing partnerships. And something that I would want to highlight is we have, and Oscar in his introduction mentioned this, we have an innovation lab within the ECD Directorate of the National Government of Colombia, which is ICBF. And it's what this means is that we, as Oscar mentioned, we incubate and implement and do research on ECD programs. And one of the key lessons, and I guess the key platforms for undertaking some of these like big questions in terms of dual generations, it's also using leveraging from that partnership. What do we have there? We partly I guess the benefits of having that is because we can know from the inside what the policy challenges are. We understand where the needs are in terms of the data and the research so we can drive those questions ideally. So that's where we were thinking this is moving forward. But a key question that I would want to highlight, and you were mentioning this at the beginning, Priyanka, enabling communities, right? So how do we make sure that we're actually able to generate favorable opportunities for these families in humanitarian context, in migration context? So we're looking a lot at social and economic integration. We're also looking a lot at legal barriers that are for families to be able to have, I guess, good transit or like good journeys once they've started them. So this is basically what we found. Lots of questions, lots of very interesting questions, lots of appetite for these questions. We, I think, have basically, at least in Colombia, this is true. We are putting together like kind of like two worlds that are not necessarily well connected. So we're talking about like kind of like all of the livelihoods and like interventions for women and for caregivers, but we're also talking about the ECD world. So as I mentioned at the beginning, the ECD world is pretty strong and has been pretty strong over the years. But how do we connect these two different ecosystems and how do we make them talk is not necessarily straightforward. There are connections, but there is still a lot to be done. Our agenda, ideally, with the Hilton Foundation moving forward, will address through different like learning and research partnerships, we'll be able to address some of those questions. Hopefully from this collaboration with ICBF, we will be able to touch on like large childcare questions related to different outcomes that I'm looking at. But yeah, there's all to be learned. That's the interesting, but also very challenging thing about dual generations. So I will close with that. I don't know if Natalia or Oscar from the Colombia team have anything else to add or highlight, or like happy to answer questions.
I don't have anything else to add.
Awesome. Any questions, reflections from the group? I guess I have one sort of like question on sort of how do policymakers sort of view dual gen programming? And this is something that we've internally discussed as part of many of our discussions in this COP series, was sort of one side of sort of dual gen programming is really programs that are targeting children, and then there are programs that are targeting caregivers, and sort of the other end of the programming is sort of integrated programming, where we're looking at children and caregivers from the same family and almost sort of supporting them simultaneously, which we started sort of thinking of as integrated programming. And as practitioners sort of within this group, I think the general sort of consensus was that the programming, which is more integrated for caregivers and children from the same families, is more impactful. But just kind of wanted to hear from both the IPA Uganda team and the Colombia team on sort of from your perspective, how are policymakers viewing sort of two gen approaches, and how do they look at it as two like separate things, or do they look at it as sort of programming that's more integrated, and therefore what are entry points for practitioners? So I think that was sort of my larger question.
I can share a bit from the experience in Colombia. So as I mentioned, Priyanka, it's very well received in theory. So as I mentioned, this is part of the law. So it's basically when you talk to people, they're like, but this is what we have always been talking about. But then the next question for that is, how do we make it happen, right? And that is the gap. Something that I think is challenging is what I mentioned about if I'm connecting two different ecosystems that are not necessarily well connected, there is like people are running into questions about their own expertise and how do you kind of like they expand the scope of their programming to be able to cover different needs. And I think there is a risk of that, right? So you don't want to push, I guess, implementers or organizations to have like these super complex programs that are trying to cover all of the needs. Because I mean, that could be, I don't know, we need research for that, but there is a trade-off in terms of the impact that you could have, right? So I think even something that we have talked in the Colombian context that we would be very interesting in advancing is just incorporating measurement to interventions that don't fit exactly the dual gen approach. And this is something that we're discussing internally. Natalia has been leading those conversations. But for example, when we talk about financial inclusion, this seems like really far from the ECD world, right? So how do I connect these two pieces? But I'm thinking about interventions that are looking at enabling caregivers to be able to get formal jobs, to access to the financial markets, and in theory to generate a lot of well-being, right? So how do I connect those? Why don't we measure children for those interventions and see what's happening at the household level? And then we can better target what the needs of those children are, or what's the scope of the programming that I need to achieve. That's to give you the extreme example, right? Because this is very far. But I think that's a key question. So what's my expertise and how much should I expand my expertise? And for example, coming from the ECD directorate in the national government. So, I mean, where do I fit here, right? Generally, very open to learn, not without challenges as with any governments. I think this is true everywhere. You have mentioned that they ask from the government, so what works, right? And we have ideas of what works, but we still have a lot of evidence to build. So we still need partnerships and governments to be able to invest time in generating that evidence, innovating. So that's why we also think that incubating ideas from the beginning within national governments or like local governments could be potentially very impactful, because kind of like you address from the inside, all of the questions from the inside, and you're able to kind of like guide that learning process. So I would stop there, and I think Natalia has her hand raised.
Yes, I just want to add something. Is in many programs, we see that the prioritization criteria is having children under the age of 6, but they don't measure. So the intention, the willingness, the idea, I think is there, but the lack of capacity to understand how the dual gen could work, how could be efficient, is the big question. And regarding refugee population, we cannot think, like, for example, in dual gen approach, if they are not able, for example, mothers to go to good employment, or if they don't have financial inclusion. So there is like two ways to analyze it. One is programming normally try to take into account as prioritization criteria both generations, but they don't measure what happened after. And we still think that we have to go a step back to try to understand if the country is actually enabling those mothers or those parents, caregivers, to actually have that dual gen approach.
No, thank you. That makes a lot of sense. Anyone else, any questions? Or any reflections or something that resonated with what was shared, something that you've been doing that was sort of like called out? Yeah, just any reflections.
Yeah, I've got a little reflection, I guess. I mean, it's interesting hearing from countries as different as Colombia and Uganda and comparing it to our own work as well, I suppose. What I pick up across all of that is the idea of working with parents and the idea of working with children is nothing new. And maybe what the idea is What is more coming to the front now is the coordination and the connection between those activities giving a bigger result than working on those things independently. And then what I picked up from both the approach, obviously it's the same organization in different countries, is kind of three main things, I guess. Evidence of impact. So working with other civil society actors, whether it's universities, whatever, generate impact of what is working in this space. And then I guess the second part is have the relationships there to bring that evidence. And I think there's probably, certainly we do this, and I've picked it up, is there's a kind of informal bringing of evidence, and then there through the relationships to get the buy-in of the key decision makers and the influencers. And then there's a more formal bringing of evidence through workshops, through forums, seminars, etc. And then maybe the most tricky part is the third piece, which is around partnership versus kind of accountability, if you like. And for us as civil society organizations, embarrassing government and exposing that what they're not doing generally doesn't really work. So you want to partner with them, support them, build their capacity, but also still playing that role of an independent civil society that does want to raise attention to where the gaps are and those kind of things. I can see Obed is nodding there, so he's feeling that as well. But that's the kind of theme I've picked up across both presentations, and it also connects, I think, to how we work as well. So thank you for that. Yeah.
Thank you, Matthew, for that reflection. I think that's key, how the different types of organizations are interacting in the ecosystem. So like local, international, NGOs, national, local governments, how do we drive this programming and policies forward? It's going to be key. It's not necessarily that we have an answer for that. Probably we'll just find it as we go. But definitely a need to coordinate and to generate more evidence.
And another thing actually wasn't there that I picked up that you made me think of it there is having 20 different NGOs and CSOs all talking to them at different times and in different ways also doesn't really help. It's that coordination of the sector to bring together. In Tanzania, for example, we've got a task force which has government and civil society on it that allows one kind of united front, whether a CSO network can play the same role as well. So yeah, that single voice, if you like, from civil society can help.
Definitely.
You wouldn't have overemphasized that, Matthew. I think, and I think I mentioned it also, the policy actors are saying, but who should we listen to? You guys come and other people come and others come and others come. Sometimes with conflicting messages that you have this donor is promoting this and then another donor is promoting something that seems not to be even the same. So the policy actors then tend to think that you are confusing us. You are telling us so much and everyone is seemingly pushing for an agenda. And I think in a separate project that I'm working on, one of the policymakers was saying, but you guys are donor funded. You bring this program and once your donation ends, then you will not be continuing with it. But somehow you want us as government to begin working on those kinds of emotions, that this wave has come, we follow that. And then this wave comes, we should follow that. So, but we are going to be here forever. So you should not be pushing us to your interests. So I think harmonizing these is a critical thing. You mentioned how our role of holding governments accountable, but also partnering with them. So I think there's a lot in there. There's a lot in there in terms of the government is perpetual. It will stay. Our projects might end. So how do we align our time-bound projects to existing government programs and policies, which by their nature are going to continue for a longer time? So that's really interesting. Thank you so much.
Amazing. I don't see any more hands up. What we wanted to do next was just a quick sort of an activity where we wanted to put you in like 2 small breakout groups and really to get you to talk a little bit more about some of the systemic challenges that you have faced in terms which has impeded the implementation of the programs that you're running in your specific context. And if there are sort of specific strategies or tools or frameworks or I think Matthew were talking about sort of the community that the task force that you've built. So just sort of other innovative ways where you've tried to sort of overcome any challenges or anything that has sort of like helped you work more collaboratively with the government. If you have examples of tools, would love for you to just share that in your breakout group. And then if you have a link or any kind of resource that we can look at further, if you could also just include that in the Jamboard, that would be really helpful. So what I think we'll do right now is just kind of break you up into 2 breakout groups for about 10 minutes. And we'll just go through each of these 3 questions within the 10-minute slot, and then we'll come back and close it, and then just go to some next steps and closing action items for the session. So Mercy, can you just divide us up into 2 groups?
Yes, I have done that already, so I'm ready to open the.
Awesome. If you could just go to the breakout group, that'll be amazing, and we'll see you back in 10 minutes. Hi, Lydia, are you here?
I think it is probably not on, but
I don't think
yeah,
she can hear
we
us.
have enough people in the different rooms.
Yeah, I think we have 3 each, so I think it should be fine.
I'll give the 3 minute
Yeah, I was just gonna ask
alerts in the
you
next
broad.
20 seconds in the groups. Sorry?
Sorry, no, say.
Do we start the broadcast or do I do it in the rooms?
The broadcast worked, I think, last time.
Okay, let me do all that. Okay.
Yeah. But this time we have the timer, so I think it should be fine. But we can say, yeah.
They'll be back in a minute.
Okay, I think that's great.
Sorry, Daniel, you're cut off.
No worries. Daniel, do you want to continue making the point if I'm not putting you on the spot?
It's fine. When I came in, I found someone was relating between ECD and how it's far from financial literacy. I mean, it's something that through the project that we've been trying to understand where the integration opportunities between a program that is offering economic and livelihood opportunities to the parents and the ECD component, because it's new field. There's a bit limited evidence of the actual translation of the support to the parent to the child. How do you tailor the trainings and the support so that the intervention really supports the parent and the parent is able to shift the mind to be able to address the needs that we want to see addressed in the children? So what are those opportunities? It is something that within the office, we're trying to develop something to try to guide us. Where is that point? Where are those points where we see ECD is very closely linked with the livelihood part, very closely? Where is it clearly? Yeah.
Daniel, sorry, which organization do you work? Sorry.
IRC. I work for IRC in Uganda.
Great. So I was the one talking about financial inclusion. So definitely very interested about your experience.
Awesome. I see lots of interesting reflections on this sheet, but just very quickly, did someone hear something that was that stood out to you or you found interesting that you'd like to share with the group? I also see some innovation examples. If you could just write your name against it in case we want to follow up with you to learn more about that, that'd be great. But yeah, just sort of like open time based on sort of your group discussions, if there's something interesting that you heard or any point that you see on any of the post-its that you'd like to elaborate on.
I can only see the one that we wrote on. That I can't. Is there a way of seeing? Did the other group write on the? Oh, okay, that explains it. If you didn't write on it, then I won't see anything. Our group, however, did follow the rules as instructed, and I guess I was selected as the speaker. So we looked at the first questions about systemic gaps. Without just reading them through. Limits of technical capacity of decision makers creates a challenge. Kind of parent-focused policy and child-focused policy not being aligned and sometimes even being contradictory. So integration and interaction is often missing. Limited capacity and understanding how to measure 2-gen approach. We can measure the child intervention and measure the parent intervention, but what is the combination of the two? That this is quite new to government, and often their guidelines don't align. Limited resourcing, limited attention to this, constrains what is possible. And a really good point, I think, was around how ministries work in silos often, and cross-ministry interaction can be challenging. So there's a real gap of multi-sectoral collaboration within government. Shall I go to the second thing? Some of the innovations, something that we did with our children in Crossfire in Tanzania was establishing a multi-sectoral task force, which was led by the government, and we supported them to set that up and lead that. And bringing the Ministry of Health and the Ministry of Education and the Ministry of Finance, different ministries together to recognize that they had a shared interest. In our case, in early childhood development, but it would apply to 2-gen as well. the idea of bringing evidence and maybe speakers from other countries where this is going well, and where governments can speak to other governments. That can be something. That the research and the evidence that we bring must cover the full kind of range of communities, the diversity of people, the diversity of populations, including, IDPs, internally displaced, so they're from that country, versus refugees who are not often from that place, and the different needs that may happen there. And that research kind of aligns and speaks to policy and policy priorities to demonstrate what works to generate initiatives within government. So that's what we came up with.
We didn't follow the rules, but we had a very similar conversation. I think we touched on many of those that you mentioned. So I think it's actually a great summary of our conversation.
That's easy for you to say. You didn't write anything down.
No, I didn't. I was on the easy side of things. But I mean, we touched a lot on the coordination issue and like the role of the government, also for leading how that actually plays out. So definitely there, we talked about kind of like generating more evidence and different needs. And we also talked about where do you draw the line in terms of the expertise for each of the organizations in the field. So like the question that Daniel was raising, so what's ECT, what's financial literacy, what's financial inclusion, what's like providing capacity to the caregivers versus providing ECD services. So I think there are lots of learning questions there. And I think someone needs to take the risk of researching on that. And something that we touched on was about the role of civil society organizations. We have here the coordination multi-sectorial task force. We have something like that led from the government. Not clear necessarily what play should civil society organizations be playing within those spaces. They do have influence in the ecosystem, so it's definitely something to understand. And also they're playing a role, they're implementing programming. So how do we coordinate among those? I think there's still a question to be answered.
Amazing. Thank you to both the groups. Just in the interest of time, just a few quick sort of like next steps from our side. So like we'd mentioned, we're working towards codifying all the learnings and all the reflections that you've shared as part of a guidebook on sort of implementing dual gen programming, and just raising some key reflections and questions that we've had together as a group. What we have is a work in progress guidebook with sort of like different aspects already written down. Specifically wanted to bring your attention to point 4 and 5, where we've really built like the archetypes of dual gen implementation based on the learnings that we had as part of the group, and also some of the core components that really came out and how they are connected with each other. But what we really have, I think, right now is a good sort of conceptual framework, but we'd like to strengthen this guidebook more with some practical examples. So if you would like to contribute to a detailed case study, or if you'd like to share templates and tools or any kind of video resources that you have, which can sort of make the guidebook a little bit more practitioner-centric and practice-oriented, we'd love to hear from you. We have a link, a form link here. You can use this to fill this form to show your interest in getting in touch with us, and we can follow up separately with you on that, or you can also just directly write to me on chat. In case you'd just like to read and review, please let me know too. We'd be happy to share a working copy, and would love your feedback in terms of the language and flow, etc., to just make it more practitioner-centric and practitioner-oriented. Yeah, I think pretty much that's what we have for now. We'll just very quickly open the poll. Mercy, if you can open the poll quickly, if all of you can take it for about a minute, and then I think you're free to go. But thank you so much to everyone for all your time. and for all your engagement, not just in the session today, but just overall through the learning series. We've learned quite a bit of reflections and insights because of your engagement, and we love to stay engaged with you over the next few months as we are wrapping up the guidebook, and we'll hopefully come back with a second version of the COP series, but maybe looking at certain specific aspects of the dual gen programming. Yeah, so on that, I'll just request you to take a minute to take the poll, and then you're free to go. But thank you so much.
Thank you, Priyanka. Bye-bye.
Thank you so much.
Thanks, everyone.
Everyone. Bye.
Thank you. Thank you.
Thank you, everybody. It's been great. Bye.
Hi, Janet, are you here?